请坐。女士们、先生们，下午好。
Ladies and gentlemen, good afternoon.
欢迎大家出席中共中央宣传部新
Welcome
闻
to
发
this
布会。
press conference held by the Publicity
今
Department
天我
of
们
the
举
CPC
行
Central
中国这
Committee.
10年系列主题新闻发布会的第27场。
This is the 27th
我们很
press
高兴
conference
邀请
under the
到
theme of China in the
国
past
家卫
decade.
健委
Today we have
副主任
invited
李斌先生，
Mr. Li Bin, Vice
国家
Minister of
中
the
药管
National
理局
Health
副局长
Commission,
秦怀金先生，
Mr. Qin Huaijin, Vice
国
Commissioner
家
of
疾
the
病
National
预防控制
Administration of
局副局
Traditional
长
Chinese Medicine,
常基乐先生，
Mr. Chang Jile,
为大
Vice
家介绍
Administrator of the
新时
National
代
Disease Control and
党的18大
Prevention
以来
Administration.
卫
They will
生健
brief you
康
on
事
the
业发展
achievements in the development of
成就，
China's public
并
health
回答各位关心
in
的问题。
since the 18th
出席
National
今天新闻
Congress of
发
the
布会的还
CPC,
有
and then take your
国家
questions.
卫健委
Here with us
的3位
today
司长，
are
体制改革
Mr.
司负责人朱洪彪先生，
Mr. Wang Haidong, Director
老
General
龄
of the
健康司司
Department
长王海
of
东先生，
Elderly Health of
人
NHC,
口监
Mr.
测
Zhu
与
Hongbiao,
家庭发
First
展
Class
司负责
Inspector
人
of the Department of
杜希学先
Institutional
生。
Reform of NHC,
下面我
and
们
Mr.
先
Du
请
Xixue,
李斌先生介绍
Special
情况。
Supervisor of the Department of Population and Family of
记者朋友
NHC.
们，大家好！
Now let's give the floor to Mr.
感
Li.
谢大家一直以来
Friends from the media,
对
good
卫
afternoon.
生健康工作的关心。
First, I would like to
和支持
thank you for your long-standing care and support
习近
for
平总
public
书
health
记指
work.
出，
General
现代化
Secretary Xi Jinping has
最重要
pointed
的
out
指标，
that the most
还是
important
人民健康。
indicator of modernization
这是
is
人
people's
民
health,
幸福生活的基础。
which is the foundation for a happy
党的
life.
18大以来，
Since the 18th
以习近
CPC
平同志为
National
核心的
Congress,
党中央，
the CPC Central
坚
Committee
持
with
把人民
Comrade
健
Xi
康
Jinping at
放
its
在
core,
优先发展
has
的
viewed
战略位
people's
置，
health as a
坚
strategic
持人民
priority,
至上、生命至上
putting
的执
people
政理
and
念，
their life first,
把人民群众的生命安全和身体健康
And,
放在第一位，
front and
确立
center.
了新时代卫生健康工作方针，把建设健
They
康中
have
国
outlined
和
the
积极应
health
对人口老龄化
strategies in the
上
new
升为
era,
国家战略，不
elevated the
断
tasks
深
of
化
building a
医药卫
healthy
生体制改
China
革，
as a
走出
national
了一条
strategy,
中国特色卫生健康
promoted
事
health
业改
development,
革发展之路，
and blazed the path of health reform with
10
Chinese characteristics.
是健康中国战
Over the
略
past
全面
decade,
实施。
the strategy
人民健
of
康
building a
得
healthy
到
China
全
has
方位
been fully
保障的实
implemented,
现，
and people's health has
制
been
定
protected
修
in
订
all
了
aspects.
基本医疗
We have
卫生与
promulgated
健
and
康
revised
促进法等
laws
法律，
such as the Law on Promotion
编
of
制
Basic Medical and
和实
Healthcare,
施了健康中国
introduced and implemented the
2030
outline of
规划纲
Healthy
要，
China 2030 plan,
深入实施健康中国行动，
advanced the Healthy China
健
initiative.
康扶贫工程，
The
累计
health-related
帮助
poverty alleviation
近
program
1000
has
万个
lifted out of
因
poverty
病致
nearly
贫返贫
10
家
million
庭
families that were
成功
poor due
摆
to
脱贫困。
illness.
爱国卫生运动
Patriotic
融入社
health
会
campaigns have been
健康
integrated
治理
into
的
all
方方
aspects
面面，
of public health
文明
governance.
健康、绿色环保的
A
生活方
civilized,
式日益
healthy,
普
green,
及，
and eco-friendly way of
居
life
民
is
健
becoming
康
more
素养
popular.
显著提高。
People's health has been markedly
这10
improved.
年是促
Over
进
the
人
past
口
decade,
长期均衡发展、
population has grown in
一
a
老一
balanced
幼
way,
健康水
and elderly
平
care
进一
and
步
child care
提高
has
的
been
10年，
further improved.
不断优化生
We
育
have
政策，
refined the child birth
先后
policy,
实施单独两孩儿、
implemented the two-child
全面
policy,
两孩儿
and then
和3孩儿生育
three-child
政策，
policy,
取消社会抚
lifted
养费
constraints
等制约措
such as
施，
social support fees,
推出一系列
launched
配套
a
支持政
series
策，
of supporting policies.
实施积极应对人口老龄化国家战
We
略，
have also implemented a
深入
national
推进
strategy for
营养结合，
addressing population aging,
积极推进老年友好
promoted
家
the
庭社会
integration
建设，
of medical care and healthcare,
母婴安
and worked
全
actively
保
to
障
build an
能力
elderly-friendly
显著提升，
society. The ability to
我 国
ensure the safety of mothers and
婴儿
infants
死亡率
has been
和
significantly
5岁以下
improved.
儿童死亡率
China's mortality rate of
远低
infants
于
and that of
中
children
高
under
收入
5
国家
are far
平均
below
水
the average level of middle
富
and
有
high-income
健康
countries.
核心指标
Core
进一步向好，
indicators of maternal and child
10年
health have been further
是医
improved.
药卫生体制改革
Over the past
持续
decade,
深化，
institutional health
人民
reform
群
has
众
been deepened,
看病
and the
难、看
difficulty
病
in
贵问题
receiving medical
加
services
速
at a
破解的10
reasonable
年，
price has been addressed
历
more
史性
quickly.
的全面
We
破
have
除
abolished
以药 补医的
the
旧
old
体制，
system of subsidizing
持续
doctors
推
with
进
selling more
以
medicines
治病为中心，
continued
向以
to
人
promote
民
the
健康为
transition
中
from
心的转
putting
变，
disease treatment at the center
推广
to
三
putting
明
people's
医
health
改
at the
经验，
center,
覆盖城乡的
accelerated the
医疗
coordinated reform
卫
of
生
medical
服
care,
务
medical
3级网
insurance,
络
and
不断
medicine,
健全，
and promoted
90%的家庭
the
15分钟内
three-tier network of
能
medical
够到
services.
达最近的医疗点，
90% of households
国
can
家
reach the
基本药
nearest
物
medical
目录
center
品
within
种
15
增加
minutes.
到
The number of
685
essential
种，
medicines on the national
基
list
本医
has
疗
increased to
保险参保
685.
人数超过
More than
13.6亿人，
1.36 billion people are
居
covered
民
by the
个人卫生
basic
支出
medical insurance,
占卫生总费
and the
用的比
proportion
例
of personal
降
health
至
expenditure in total health
27.7%。
expenditure dropped to 27.7%.
这10年
Over the
是
past
公
decade,
共卫生防护网
the safety net
筑牢之
for
力，
public health
传
has
染病、
strengthened,
慢
and
性病、
contagious, chronic,
职业病、
occupational,
地方病防
and
控
endemic diseases
更
have been more
有效
effectively
有力的10
controlled.
年。我国消除了疟疾，
We have eliminated
实现了
Mal-
乙肝
malaria
控制目标，
controlled
艾
hepatitis
滋
B
病疫情得到
and
有
the
效控制，
AIDS.
重大慢性病过早死
The
亡率
premature mortality
低
rate
于
of major
全国
chronic
平均水
diseases
平，
is lower than the global
尘肺病
average.
等
The
重
high
点职
incidence
业病高
of
发势头得到
pneumoconiosis
初
and
步遏
other
制，
major occupational
血
diseases
液丛病
was
疫
basically
情
curbed.
降至历史最
The
低水平，如期
schistosomiasis
实现
epidemic
地
was
方病
reduced
防治
to the
3
lowest
年
level in
攻
history.
坚行动目标。
The target under the
面
three-year
对
campaign to
新
prevent
冠
and
肺
control
炎疫情，
endemic diseases was
这
achieved as
100年
scheduled.
来全
We have
球
stood
最
the
严
test
重
of
的
the
传染
COVID-19
病大流行。
pandemic.
我国坚持外防输入、内
We
防
have
反
followed
弹
the
总
strategy
策
of
略，
guarding against inbound
和
cases
动态
and
清
domestic
零总方
resurgences
针，
and the dynamic
因
zero
时因
COVID
势
policy,
不断调整
and
防控措
adjusted
施，
the prevention and
最大
control
程
measures
度
according to the
保护
time
了
and situation,
人民群众
so that
生命安
people's
全
lives and health
和身体健
are
康，
protected to the greatest
统筹了疫
extent.
情防控和经济社
We
会
have
发
also
展，
coordinated
经受
COVID
住了
response and
严峻考
economic
验，
and social development.
充分展现了中国精神、中国力量、
Our
中国
efforts
担
have
当。
fully demonstrated China's strengths
这10
and
年
China's wisdom.
是卫生人
Over
才
the
队
past
伍
decade,
整体
the
素质不
capacity
断
of
提高，
medical workers,
医疗
the
技术
level
能
and
力
quality
与
of
质量水
medical
平双提
technologies
升的10年。
have been improved.
到2021年，
By 2021,
我国卫生人员总量
the total number of health
达到
personnel in China
1398.3万人，
13.983 million.
各类人才队伍
The
规
scale
模
of
不
talent
断
of
壮大，
various kinds has grown.
基层卫生专业技术
The
人员
proportion
占
of
比
health
达到
professionals at primary level
72%，
has reached
构
72%.
建优质高效
We
医
have
疗服务
built
体系，
A high
设
quality
置
and
国
efficient
家
medical
医学
service
中
system.
心和国家区域医疗中心，
Set up
加
national
强
medical
医联
centers
体
and national
医
regional
共体
medical
建设
centers.
和
Strengthened
县域
the
综合
development
医
of
改，
medical associations
50%
and
的县
comprehensive
医院
medical
能
reforms in
够开展
counties.
复杂手术，
50% of
推
county
进
hospitals
大
are
病
able to
重
carry out
病
complex
在
surgeries.
本省解决，
We have encouraged the
一般
trend
的
of
病
addressing
在
major
市县
diseases
解
in the
决，
province, general
头疼
diseases
脑
in
热
cities and
在
counties,
乡镇
minor
顺利解
ailments
决，
in towns and villages.
年人均
The annual per
诊疗
capita
次数、
number
住院
of
率
medical
等指标
consultations,
逐步
hospitalization
达到
rate, and other
或
indicators
接近
gradually
发达国家
approach the
平均
average
水平。
level of developed countries.
这10年
Over the past
是中
decade,
医药守正
TCM
创
has
新、
enjoyed
传承发展，
innovative
让更多
innovative
群众
development
方
and
便
has been carried
看中
forward
医，
to make it more
放心
accessible and
用中
reliable
药的10
to
年，
the public.
加快建设
We have sped up
高效
The
中医药
building
服务
of
体
a high
系，
quality and efficient
基层
TCM
中
service
医药服
system,
务能力
significantly improved TCM
显著提
services
升，
at the
中医药
primary
服
level,
务更公平，
made
更可及
TCM
更便
more
利，
equitable, accessible, and
推
convenient,
动中医药走向世界。中医药
promoted
已
Chinese
传播
medicine
至
to the world,
196个
reaching
国家和地区。
196 countries and regions.
这10年
Over the past
是
decade,
卫生科技发展日
health
新月异，
science and technology
参与
enjoyed
全
rapid
球卫
progress
生治
with
理
more
更
in-depth
深
and broader
更广的10年。
participation in global health governance.
新药专
The
项
new drug
推动
campaign
我国
has
新药研
promoted
发
the
由
leap
仿到
forward
创的
develop
跨越式发展，
the leapfrog development
传染
from
病
imitation
专项
to innovation in
提升我
R&D.
国及时有效应对新发突发传染病的
Special
综合
campaigns
防
has been
控、
carried out to
应急处
improve
置
our
和
ability
科学研究
to
能力，
address
深入
emerging
参与全球
infectious
卫生治理，
diseases. We have
扎实推
actively
进
participated
健康
in
丝绸
global
之路
health
建设，
governance, made
持
solid
续开
progress in the
展卫
development
生
of the
援
health
外
Silk
工作，
Road, continued
在
to
抗
carry
击
out
埃博
foreign
拉、
assistance
新
on
冠肺
health,
炎等疫情中，
and did our best
体现了构建
to
人类
provide
卫
assistance to
生
the
健康
international
共同体
community.
的大
All
国担
these have
当。
demonstrated our responsibility as a major
总的来
country in
说，
building a
这
global
10年
community of health for
是我
all.
国
In
卫
conclusion,
生健康
the
事
past
业
decade
进步最
has
大，
witnessed the
老百姓
greatest progress
健
in
康获
China's
得感
health
不
and a
断
growing
增强的
sense
10年，
of health gain for the public.
人均
Life
预期寿命
expectancy rose
从
from
74.8 岁
76.8 to
78.2 岁，
78.2,
这是一个历史性的跃升。
marking a
主要
historic
健康
jump.
指标居于
Major
中高
health
收入
indicators
国家
are
前列，
among the highest in middle and
人
high
民
income
群众
countries,
的健康权益
and
得到充
Chinese
分保
people's
障，
right to health is fully
更加
protected.
凸显了以习
This
近平同
speaks
志
volumes
为核心
about
的党中央
the
坚持以人
people-centered
民为
development
中心的
philosophy that the
发展思
CPC
想。
Central Committee with Comrade Xi Jinping
我
at its
们
core
将
upholds
继续完善
We
国
will
民
continue
健康政策，
to
为人
improve
民群众提
our
供
health
全方位、
policies
全周期健康服务，
and provide
为实现第二个
all-round
百年
health
奋斗目
services
标
for the people,
筑牢健康之基。
so as to lay a solid foundation for
下面
achieving the second centenary
我和
goal.
我的同事愿意回答大家的提问。
Next, me and my
谢谢。
colleagues will take your questions.
谢谢
Thank
李
you.
主任。下面欢迎各位
Thank
提
you,
问。
Mr. Li. Now the floor
提
is
问之
open for
前，请
questions.
通报一下自己所在的
Please
新闻记录。
identify your media affiliation before raising
第
questions.
二排这位女士。
中央广播电视总台央视记者提问。
CCTV
健康中国呢，作为一项国家战略和人民群众的获得感、
Building
幸福感
a
和安
healthy
全感
China
是
is
息息
a
相关的。
national
那么
strategy.
我
It
们
is
15规
vital
划呢，还
for
有
people's
这个
sense of
2035年
fulfillment,
年景目标
happiness,
纲
and
要都提出了，
safety.
要在2035
And
年
the
建成
14th
健康
Five-Year
中国。
Plan
那想
and
请问一下，现在
long-range
健康中国各
objectives
项工作的推进
2035
情
have
况怎么
put
样？
forth
阶
the
段性
goal
目
of
标的
building
这
a
个实
healthy
现的进
China
度如
by
何？老百姓在这其
2035.
中收
How
获了
are
什
the
么样的健
targets
康
are
获得
being
感？谢谢。
met, and what benefits have been delivered to the
好。
people?
这个问题啊，我来回答。
I'll take
这个
your
健康中国
question.
建设呢，得到了方方面面的这个关注。
Well, building
这个
a
相关
healthy
的
China
整
has
个工作的
received a
情
lot
况
of
呢，主要
attention.
呢，就是现在在工作推进的过程中呢，主要体现在以下几个
As
方面：
we advance this program,
党中央、国
we
务
have
院
made efforts
高度
on the
重视
following
人民
areas.
群众的健康，
Well, first, the
坚持
CPC
把
Central
健
Committee
康
and
呢
the State
摆在优先
Council
发展的
take
战略地
people's
位，
health very
做
seriously.
出了实施
They
健康
put
中国
people's
战略的
health
重大决策
at
部署，
a strategic
明确提
priority
出
place
2035
and
年
made the
建
important
成
decision
健康中国。
of building
我
a
们认
healthy
真贯
China
彻
by
党中央、国务院
2035.
的
We
决策
have
部署，
honestly implemented
会同有
the
关部
decisions
门
of the
多
CPC
策
Central
并举，
Committee and the
狠
State
抓落实。
Council, and we worked with
健
relevant
康中国行
departments
动
to implement
2022
the
年
necessary
主要
measures.
的目标
The
提前
main
实现。
targets for 2022
健康
in
中
building a
国
healthy
建
China
设
have been
开局起步
achieved,
良好，进展
advance
顺
of
利，
time, and
一是
the
健康
initiative
度
has
万
gotten
岁，
off to a good start.
促进
First
健康
is
的
to
政策
mainstream
体系
public health
基本建立，
and the
成
system
立健康中国
of
行动推进委员会，
policies for health
组
have
建
been
专家咨
basically
询
put in
委员
place.
会，
We have set up
探索
relevant
建立
committees
健
for
康影
expert
响评价
consultation and
评估
for
机制，
taking actions. We
形
also
成
set
了
up
部门协同
a evaluation
省市县
system for
联动的
assessing
工作
the
格局。
health impact and
二是
enabled coordination
知识
between different
进万家，
departments and
健
provinces.
康科普
Second,
两
we are
库
also
一机
raising
制，
awareness among the general public
建
and
立
put in
国家
place two
健康科
pools and
普
one
专家
mechanism.
库和
We
资
have
源库
put，in place
全媒
pools
体
of
健
experts and
康
pools of
科普知识
resources
发布
for
和
health
传播机
knowledge
制，
awareness raising
全面
campaigns
普及
and
健
an
康
all
知识。
media
三是关注
mechanism
全
for
周
health
期，
awareness raising has
健
also
康
been
维
established.
护能力明
Third,
显
we
提
pay
升，
attention to the whole cycle,
人均
and
基
the
本公共卫生
capacity
服务经费
for
补助标准
maintaining health
提高
have
到
been
84元，
raised. The per
为
capita
高血压、
subsidies for public
糖尿
health
病、
services
结
has
核
been
病
raised to
等重点
84
疾病的
yuan.
患者
We have also
和0到
provided
6岁的儿童、孕产妇、65岁以上老年人等重点人群
public services,
提供
health
健
services
康
to
管理服务，
key demographics,
综合
including
防控
pregnant
儿
women,
童、青少年
old
近视工作扎实推进，
senior citizens
学
aged
生
65 years
体
and
脂
above,
健康
and
状
also
况
young
逐步提升，
children.
重大疾病 得到
we
有效遏制。
have also
重大
effectively
慢
contained
性病
major
过早
diseases.
死亡率低于全球平均水平。
Premature mortality
三
rate
是
of
生活更健康。
major
生产
chronic
生活环
diseases
境
are also
持续
lower
改
than
善。
global average.
健康
Fourth,
生活方式成
People's
为
lives
新的时
is
尚。
healthier,
居民
and
健康素养
the
水平
production and the
提高
living
到
environment are being
25.4%。
improved. People's health
体育
awareness
场地的
level
面
has
积
been
不
raised
断
to
增强，
25.4%.
经常
The area
参
of
加
sports
体育
venues
锻炼的
is on
人
the
数的比
rise,
例达到了
and as many as
37.2%。城市生活环
37.2%
境
of
改善明
people
显，
often
空气质
participate
量
in
优良
sports
监数的比例
activities and
持续提
fitness
升。
activities. Urban
农
living
村卫生
environments
面貌
have
焕
been
然一新，
improved, and air
自来水
quality
普及率、
is also on the rise.
卫生厕所
The
普及
rural
率
areas
逐
has
步提
taken
高。
on a new look. Access
五
to
是
tap
全
water and
民
clean
齐参与，
toilets is steadily
健康中
increasing.
国行动的
Fifth,
氛
we
围
also
日
encouraged
益浓厚。
participation of
共建
all
共
the
享
general public.
全民
There
健
is a
康是
growing
健康中国
sense of
的战略主题。
awareness for
大
building
力
a
倡
healthy
导
China.
每个人都是自己
We
健康
are
的第
promoting
一
the
责任
idea
人，
that everyone is
形成了
primarily
人
responsible for
人
their
追
own
求健
health,
康、
and we
维
have
护健
created
康的
a good
良好
social
社会氛围。
atmosphere
谢谢。
for pursuing health and
下一个
staying
问题。
healthy. Next question, please.
东区第4排那位女士。
中国青年报记者提问：医改是一个世界性难题，请问深化医改是如何推进的？
China
取
Youth
得了哪
Daily.
些成效？有哪
Healthcare
些启
reform
示？
is a
谢谢。
global challenges. What progress has been made and what experience has been
我们
accumulated?
改司的朱鸿标先生呢，来
I'd
回答
like to
这个问题。
invite Mr. Zhu Hongbiao to answer this question.
谢谢您对医改工作的关心和
Thank
关
you
注。
for your
也
care and
正像您所
attention
讲的一
to
样，
the healthcare
医
reform.
改啊
As you
是一个世
mentioned,
界性的难题，
healthcare reform is a global
尤其像
challenge.
我们国家有着14亿多人口
For
的
China,
发展中，
a country with 1.4
改革
billion
的难
people,
度啊更大，
it is even
也
more
更为
difficult
艰
and
巨和复
challenging.
杂。党的18大以来，
Since the 18th
我们
CPC
按照
National
党中央、
Congress,
国务院关于深化医改的顶层设计，
we have followed the top-level
抓试点
design of
示
the
范，
healthcare
抓
reform,
重点难点突破，
focused on
抓统筹协调，
key
抓督导
key
评价，
difficulties and areas.
总结推广以3名为代表的典型地区的医改经验，推
And
动
we
医改
focused
往
on
深里走，
accumulating
往实里走，
resources in
努力
cities
解
like
决群众
Sanming,
看病就医的难题，医改
address
取
people's
得显著的
difficulties in
成效。
receiving medical treatment, and achieved a lot of
一是
progress.
群众看病难问题有效缓解，
First,
设置了
the
12个专
difficulty
业
in
类
receiving
别
medical
的
services
国
has
家
been
医学
addressed.
中心，
We have set up
建设
a number
50
of
个
medical
国家区域医疗
centers
中心，
and regional
组建
medical
各种
centers,
形式的医联体1.5万个，
and
推动
and
优质医疗
15,000
资源下沉。
medical consortiums.
2021年，
In
首批国
2021,
家区域医疗中心相关
The
专
first
科的
batch
跨省就医，
of
较
national
2019
regional
年
medical centers
下降了
have been established.
9.3%，就医
And
的秩序更趋合理。
people have greater access to medical
二是群众
services.
看病贵问题得以减
Second,
轻。
People
公立
can
医
now
院
receive medical
全部
services
取
at a
消
more
药
reasonable
品
price.
和耗材加成，
We
基
have
本医疗
removed
保
the
障
added
能力
value on
稳步提升，
medicines and other
推进
equipment.
国家组织药品耗材集中采购和使用。已经开展的
We have promoted the
7批基
collective
材重点
purchase
药品
of
平
medicines
均
and
降
other
价
medical
超过
equipment and
50%，
reduced
2批耗材基
50%
材的
of
平均降价
reduced the
超过
price on 50% of
80%。
the drugs.
开展药品谈判议价工作，平均降价超过50%。3是以健康为
Third,
中心的改革导向更加突出，
We have taken a
以大健康
health-oriented
理念
reform
为引
approach.
领，把预防放在更加突出的位
We
置，
put
实施
prevention
健康中国
at a
行动
more。outstanding place.
每个人是自己
Implementing
健
the
康
Healthy
第一
China
责任人的
initiative
理念更加深入人心，
so that
加
the
强重
philosophy
大
of people
传疾病的
making
防
responsible
治
choices
和
for their
慢
own
性病
health
的健康管理，
is more popular.
改革完善疾控体系，发挥中医药的独特优
We
势
have，also
开
made good
展医
use
养
of the
结合、
TCM
卫生健康
combined
事业
medical
发展的
care
方式
and
和工作
healthcare
模式不断创新。
and innovated our
在
way of
深化医改
providing
的实
medical
践中，
services.
我们认识到，必须
In
坚
this
持
process,
党的领导，
We've become aware
以
that
人
we
民
must
健康为中心，
uphold the
维护
leadership
基
of the
本医疗卫
CPC,
生事业的
put
公益
people
性，
front and center,
坚持系统观念，
follow a
推动各
systemic
项医
approach,
改政策协同联动，落地见效。
make
下一
coordinated
步，
efforts
我们将
on
立足国情，
medical
充
reform.
分发挥制度
Next
优
step,
势，
We
继
will
续
continue
探
to
索
bear in mind
用中
our
国式
national
办法
conditions,
破解医改
address
这
the
个世界性
difficulties
难题。
in medical
谢谢。
reform with Chinese
这
wisdom.
个问题，
Thank you. Next question,
继
please.
续第二排这位女士。
谢谢主持人。南方都市报 N 视频记者提问：10
Southern
年间，我国
Metropolis
进行了
Daily.
多次生育政策调整完善，请问如何看待
Over
我
the
国
past 10
当
years,
前的
we
人
have
口形
made
势，以及在促
adjustments
进
to
人口长期均衡发展方
childbirth
面，未来还
policies
将如
many
何做？谢
times.
谢。
How do you view China's current population
谢谢。
situation, and what
这个问题啊，
measures will be taken
请我
in
们为
promoting balanced
人口
development of
监测
population in
与
the
家庭
future?
发展司的杜希协
Thank
先
you.
生呢来回答这个问题。
我来回答这个问题。
I'd like to invite Mr.
党的18大以
Du
来，
Xixue to answer
以
this
习近平同
question.
志为核心的党
Population
中央
development is
站在
one
中
of
华
the
民族
top
文化复
priorities
兴
of
的
the
战略
country.
高度。
Since the
根据
18th
我国人
National
口发展
Congress,
形势变化，
bear in
做出了
mind
逐步调整
the
生育政
strategic
策，
task of the
促进人口
rejuvenation of
长
the
期均衡
Chinese
发展
nation, the
的
CPC
重大
Central
决策，
Committee, with
先后
Comrade
实
Xi Jinping
施
at its
单独
core,
两孩政
has
策、
made major
全面两孩政
decisions
策、三孩
in
生育政
accordance
策
with the
及
changes of
配套
our
支持措施，
population in China.
各项
For
工作不
example,
断
we
取得
have
新的成效。
implemented
出
the
生人口
two-child
中
policy
二
and the
孩及
three-child
以上占
policy
比由政策
and
调
other
整前的
supporting
35%左
policies.
右，
The
提高到
proportion
今
of
年的
birth of a second
55%
child
以
or
上。
more has increased from
出生
about
人口性别比
35%
逐步
to
趋
over
于正常水平，
55%.
优
The
生
sex
优育水
ratio
平
at
不断
birth
提
gradually
升，
returned to the
农业
normal
安
level.
全得到
The
有力保障，
prenatal and postnatal
普惠
care has
托育
been
服务
improved.
开具良好，政策法规、
Universal care
标准
services
规
got
范
off to a good
及服
start,
务供给体系
with
基本
policies, regulations, standards, and
配套支持
service
措施
supply
不断完善，
systems
切实
basically in
减轻了
place.
家庭的生育
Supporting
养育负
measures
担
have。been improved
新时
to
代，我
effectively
国人口
reduce
发
the
展面
burden
临
of
一些深刻
childbirth and
变化，
parenting on families.
总人口增速明显放缓，生育水平持续走低，
In the
老龄
new
化程
era,
度不断加深。
the total
我们将
fertility
顺
rate
应人民群众期盼，
is
将
at a
婚嫁、
relatively
生
lower
育、
level
养育、教育一体考虑，加快构建
and
生育支持政策体系，
face
大力发
when
展
we
普惠托
face
育服务，
unbalanced development among
切实解决
regions
群众后顾之忧，
and in response
释放生育
to
潜能，
people's expectations,
保障
we
人
will
口发
take
展战略
marriage,
目标顺
childbirth,
利实现。
parenting, and
谢谢。
education into consideration,
下一
and
个问题，
vigorously develop universal childcare services, and to ensure the smooth realization of the goal of population development in the new era.
谢
Next
谢主持人
question.
澳门月刊记者提问：中药
Macau
是中
Daily.
医药传承创新发展的物质基础，是中医药特色
TCM
优势发挥
drugs
的
are
重
the
要载体。
foundation
我们
of
过去10年，
TCM
我国中药发展
development
情
and
况如何？
continuation.
未来发展计划是
What is the your assessment of TCM development over the
这
past
个
10 years, and
中
what
药
is the
非常
future
重要。
development plan?
今天呢，
Well, TCM is
国家
very
中药管理局
important,
副局长秦怀金
and
先生
today we have with us
也来参加
Deputy Head
我们这次这发布会。
Minister
要
Qing
不然
of
请
the National
秦怀金
Administration
先
of
生来
TCM
回答
to our
这
press
个问题。
conference, and I'll
好，
give
谢谢
this
您提问。因
question
为
to
你这个问题
Minister
非常
Qing.
重要。
Well, that
过
is
去
a
10
very
年呢，应
important
该说是我
question.
们
Over the
新
past
中国
10
成立以
years,
来，中医药事业发展最好的一个时期。
we have seen the
中
best
药啊，
period of
就像你讲
TCM
的，
development
中药
since
是
the
中
founding
药
of the
传承创新发展的物质
People's
基础。
Republic. As you said,
在相关部
TCM
门的
drugs
共同
are
推动下，
the
中
foundation
药
of
的
TCM's
产业发展、
innovative development.
中药的
Thanks
质量
to
提升、
The support of
中药的
the
科技创
government,
新等等方面
the，
可以说
quality,
呈
the
现了良好的一
innovation
个
of
发展态势。
TCM has
一
been
是呢，
growing
中
with
药
a good
产业快速发
momentum.
展。
That is why
依
the
托
TCM
全国重
industry
点
has
实验
been
室、
growing
国家工程
rapidly,
研究中心
relying on
等国
the
家级
state
的
key
平台，
labs and
持续
national
深化
engineering
产学
research
研
center
合
and
作。
other
国家中
platforms.
药
We
局、
have been
国
actively
家发展
promoting
改革委
cooperation
共
between
同实
the
施
manufacturers,
中药标准
academia,
化
and
项目，
researchers,
加强
and
中
we
药
have implemented
生产的
relevant
全过程
programs
质
to
控、
strengthen
中药
quality
制药的
control
装备
of the
优化
manufacturing of
升级，
TCM, and
促
also
进产业
upgraded
智
the
能绿
relevant
色发展。
facilities in producing
目
TCM
前
and
以
promote
中药
green and
农业
smart
为基础，
development of the
中
industry.
药商业为纽带，
Now now
中
we
药
have
工业为
focused
主
on
体的产业体系
commercialization of
日益完善，
TCM.
产业
and
发展
also
态势
promoted
良好。
the TCM
根据
industry,
全
which
国
is
医药
growing
工业
with
统计
a
数据
sound
显示，
momentum.
中药工业
Statistics
主
show
营收入
that the
有
income of
2012年的
TCM industry
5156亿元，
has
增长到
increased from
2021年的
515.6 billion yuan
二
to
是中药
almost
质量不断
700
提
billion
升。
yuan
我们完
last
成
year.
了第4次
The
全国中
quality
药
of
资源
TCM
的
is
普查，
also
摸清了
increasing and
中药资
improving.
源的加
We
点，
carried out the fourth
中药材
national
野
survey
生
of TCM
变加重
resources,
及替代
and
种
we have made
研究值的突
breakthroughs
破，
in
生态种
domesticating
植加快推
wild
广，
TCM
中药
resources
追溯
and
系统
finding
应
their
用范围不断
alternatives.
扩大。
We have
多部
also
门联合
expanded the
印发
scope
了
of using
全国道地
TCM.
药材生产基地
We have
建设规
also
划、中药材
introduced
生产质量管理规
planning
范
programs for
等文
planting
件，
TCM
共同加强
herbs
源
and
头管理。
materials to
国家药监
strengthen
局
the
2021
source
年
management of
国家
TCM
药品抽
materials.
检的年度报告显
And
示，
among the
中药
survey
饮
conducted
片
by the
抽
National
检的综
Medical
合格率达
Products
到98%。
Administration,
三
98%
是
of the
中药科技
TCM
创新不
decoction
断深入，
pieces being
国家中药
surveyed
管
are
理
safe
局、
and
科技部
effective.
等部门持
The
续加大
NMPA
中药的科技
and
投
relevant
入，加
authorities
强道地
have
药材、
increased
中药炮
input
制、
in
质量保
developing
障、新药研发
TCM to
等方面
ensure
的
high
研究，
quality of the
积极配
TCM
合
and
国家药监
also
局改革
to
完
strengthen
善
R&D
符
of
合
new
中药
TCM
规律
drugs.
的中药
We
审评审
have
批制度，
also put in
建立中医
place
药的理论、人
science-based
用经验和临床经
approval
验
system
三结
to
合的审
increase
评
the
证据体
clinical
系，
experience
进一步
so
激发
that
了
our
中药
approval will
科
be
技创
based
新的活力。
on sound
下一步
evidence.
国家中药管理
And
局
this
将
would
认
also
真贯
give
彻落
dynamism
实
to
“十
the
四五”
TCM
中医药发展规
industry.
划要
And
求
going
和
forward,
中
we
药
will
振兴
earnestly
发展的
implement
重
the
大工
14th
程的
five-year
部署，
plan for TCM
加强与有
development
关
and
部
the
门
major
的协
project
作，
for
围
continuation
绕
and
中药
innovation of
种植、
TCM,
研发、生产、使用全过程，
promote
充分
plantation,
发挥科技自身的引领作
manufacturing
用，
and innovation
促
of
进
TCM,
中药质量的提升，
and
深化
highlight
纯正研究，
technical and
更好
scientific
彰显
support,
中药临床价值，
promote
满
high
足人民
quality
群众的用药
development
需
of
求。
TCM
谢
and
谢。
meet people's needs for TCM drugs. Thank you. Next question,
东
please.
区第4排那位女士。
A question from the Straits Times. So this is a question about COVID-19, and given that it's been nearly 3 years since the pandemic started, is the country's current dynamic zero COVID policy at odds with economic growth? And how long more can we expect dynamic zero to continue? And furthermore, since over 90% of the Chinese population is now vaccinated, can we expect a timeline for the country to move towards living with the virus? 与病共处. Thank you.
请翻译一下。
您好，我是来自新加坡海峡时报的记者。我们知道，现在距离新冠疫情爆发已经有3年的时间了。中国当前的动态清零政策是否与经济开放相冲突？动态清零还会持续多长的时间？既然已经超过90%的中国人民已经接种了疫苗，中国是否打算改变政策与病毒共处？是否有相关的时间框架？
好，谢谢。这个问题啊
Thank you for your
请
question.
国家这个疾控局副局长常基乐先生
I'd like to
回答
invite Mr. Chang Jile to answer this question.
非常感谢这位记者朋友的提问。
Thank you for your question.
动态清零政策呢
The，dynamic
就
zero
是要
COVID
立
policy
足、抓早、
is based
抓小、
on the early
抓基础，
detection of minor
提升疫
symptoms
情防控
to improve the
和早
ability of
发现的能
prevention
力，
and early detection of
快速提
COVID-19,
早的发现
quickly
感染者和
detect
疫情，
infected people
做到
and
呢
the epidemic,
发现一起，扑灭一
to
起。
immediately address the
最低的社
cases
会
one by
成本
one.
在最
With this,
短
we
的
are
时
able
间
to
内，
bring infection
控
under
制住
control
疫
in the
情。
shortest time and at the lowest social
习近
cost.
平总书记
General
强调
Secretary Xi
精准
Jinping
防控，
has stressed the
努力用
importance of
最小的
targeted
代价
prevention and control,
实现
and
最
that
大
we
的
must
防控
strive
效
to
果，
achieve the biggest
最
results at
大
the
限
lowest
度的
cost,
减少
and
疫
minimize
情
the
对
impact
经
of
济
the
社会
pandemic
发
on
展的影
economic
响。
and social development.
这也是中央一以贯之的
This
要求。
requirement from the central authorities is unchanged.
评价疫情防控
政策措施的成
As for
本
the cost
要算
of the
总
prevention
账，
and control policies and
应
measures,
该
we
呢
should bear in
将
mind
全国
the
作
whole
为一个
country,
整体，
its economic and
算
social
大的
development,
经济
and
账、
people's
大
livelihood,
的社会账、大的
and
民
the
生账
country's overall
和
interests.
大的健康账。我国的防控理念一直是坚
Our
持
philosophy on
人民
prevention and
至
control
上、
measures
生命至
is
上。
about putting people and their
防
life
控
first.
措施的目的
Our
就是
aim of these
最大
measures
可能减缓
is
疫
to
情对
minimize the
经济
impact
社会的影响。
of the pandemic
当
on
然呢，
economic and social
这些措
development.
施也难免会对正常的生
These
产生
measures
活
may
造
cause
成
some
一些不便，
inconvenience to normal production and
但
life,
坚持全国一盘棋，
but we must bear in mind the
在有
overall
疫情
interests
的
of the
地区
country. In
采取
infected
局
areas,
部的
we have
严
taken
格的防控
targeted
措施，
and strict prevention
保
measures
证了全国大部分地区
to
和
ensure
人
normal
群的
production and
正
life
常生
in
产
most
生
parts
活，
of the country,
保证了供应链的
and the
稳
stability
定。
of the supply chain.
如果算总账，
So in
我们的
general,
防控措
our
施
prevention and
是
control
最经
measures
济的，效果
are
也是最
most
好的。
effective and efficient.
我们面对的是一场百年不遇
We are
的传染
faced
病
with
大
a
流行。
pandemic unseen in
当
a
前呢，
century.
全球疫情仍处于
The current
高位，
pandemic is still at
病
its
毒呢
height,
还在不断
and
的
the
变异。
virus is still
我们对
mutating.
于新冠病毒
Our
和疾
understanding
病的
of
认识
COVID-19
还
is
处在
still
不断
increasing
的深化的过程中，还有很多的不确定性。
and face a lot of
疫情带来
uncertainties.
的风险和威胁仍然
The
存在。
risks and threats brought by
我们必须
COVID-19 still
坚持
exist.
我们必须以坚定不移的
We
战略
must
定
have
力，
unwavering
处理好
strategic resolve
短期和长
to
期
balance the relationships between
和
short-term
整体的
and
关系。
long-term, partial and
因
overall
时
goals.
因地
Adjust
因事
prevention and
不
control
断优
measures
化防控政
according
策
to
的措施，
time and
高
situations.
效统筹疫情防控与经济社会
Coordinate
的发展，
COVID-19 prevention
这
and
呢
control with
既
economic
是
and social
秉
development.
承科学精神、科学态度的基本要求，
This is a basic
也是
requirement
遵循科学
and
规律
a
的
realistic
切实
choice
选择。
based
谢谢。
on science. Thank you.
下一个问题，
Next question, please.
继续第3排这位男士。
谢谢主持人。每日经济新闻记者提问。
National Business
10年
Daily.
间，我们的公共卫生体系
Over
先
the
后
past
经历
10
了
years,
H7N9 禽
Our
流感、
public health has
中
stood
东
the
呼吸综
test
合症、
of
埃
major
博拉
infectious
新冠肺
diseases
炎
like
等重大传染病
H7
疫情
and
和地
9,
震、洪水
MERS,
等自然灾
Ebola,
害的考验。
COVID-19, and the test
请
of
问经历了
earthquakes,
一次
floods,
次
and
与
other
突发
natural
公共卫
disasters.
生事件的正面硬刚，
So with all
我
these
国的卫
previous
生
fights
应急能
against
力
public
取得了
health
怎样的
emergency,
发展？
what progress has been made in health emergency response
谢谢。
capacity?
还是请常继乐先生呢继续来
I'd
回
like to
答。
invite Mr. Chang to answer this
好。
question.
也谢谢这位记者朋友。
Thank you for your question.
卫生应急能力是卫生
Health
健康
emergency
综
response
合实力的
capacity
体现
is。the embodiment
这
of
10年来呢
comprehensive，health
相
strengths.
关部门
Over the
和
past
地方
decade,
共同围绕
relevant
以卫
departments
生应急
and
体
localities
系
have worked
和核
together
心能力
to
建设
strengthen and
为主
improve
体，
health
不
emergency
断地加
management,
强和改
focusing
进
on health emergency
卫生
response
应急管理
system
工
and
作，
core capacity
全面
building
提升卫生健康系统
in order to
应对突
enhance the
发事件
capacity
的
of the
能力和
health
水
system
平，
to respond to emergencies,
也为维护全球公共卫
and
生安
also
全
contribute
发挥了
to
重
global
要的作
public
用。
health security.
于是呢，我
First,
国卫生应急体系初步的建立了。
the health emergency
经过
response
多
system
年的
is
不懈努
basically
力，
established in
卫
China.
生应
After
急
years
法
of
治体
efforts,
系
the legal
基本
system
建立，
of health emergency
管理
response
体
has
制
been basically
初步的
established.
形成，
The management
能力
system
水
has taken
平
shape.
明显的
The
改善。
capacity has been significantly
我国
improved.
于2014年如期
In
实现了
2014,
国际卫生条例的要
the
求
target
的能
under
力
the national
和
health
建设目标。
regulations was achieved as
二是呢，
scheduled.
卫生应急核心
Second,
能力达到
The
了
core
国
capacity
际
of
的
health
先进
emergency
水平。
response has reached the global
我国
advanced
建成
level.
了全球
China
最
has
大
put in
的
place the
传染
world's
病疫
largest
情和突发公共
online
卫
direct
生事
reporting
件
system for
网络
infectious
的直报
diseases
系
and
统，
public health
突
emergencies,
发公共卫生事件信息
shortening the
行
average
政报告
reporting
的时
time
间
for public health
缩短到了
emergencies
4个
to
小时以
4
内。
hours.
已经具备在72
and
个
is now
小时内
capable
检测
of detecting
300多种
more
病
than
原体的这种
300
能力，
pathogens within 72
建立
hours.
了突发公共
A
卫生
public
事
health
件
risk
风险
assessment system
评
for
估制度，
emergencies has been established,
在全国呢已建成
and
4
China
大
has set up
59支
59 national
国家卫
health
生应急队
emergency
伍。
teams in 4 categories.
3是呢
Third,
科学高效做好突发公共卫
prevention,
生事
control, and
件
response to
防
public
控
health
和应对，
emergencies is conducted in a
围绕
scientific and
传
efficient
染
manner,
源、传播途
focusing
径
on the source
和
of
易感
infection,
人群
route of
3
transmission,
个
and
环节啊，
susceptible population.
强化
We
预
have
防预警
strengthened
措施，
the prevention
提
and early
升
warning
快
measures,
速反应的能力，
improve the rapid response
确
capacity,
保事件有效处
and
置，
ensure the effective handling of
实
the
现了
incident.
突发公共卫生事件
The
总数
total
下降，
number of public
死
health
亡人数减
emergencies
少
and， the number of deaths
重特大
have
疫
decreased.
情得到有
Major
效控制。
outbreaks have been brought
特
under
别是以后
effective
呢，
control,
刚才您也提到，高致
especially
病性禽流感，比如说 N7、H7、N9
H7
等等
and
的以后的
9,
新发传
and
染
other
病，
new infectious
还有像
diseases,
中东呼吸综合症
and MERS,
等境外输入的疫情，这些以后呢都得到
and
了
other
成功的处
imported
置，
dis-
为埃博拉
cases and
出血热
diseases.
疫情的防控呢做出了国际贡
China
献
has。also made
新
international
冠肺炎疫情
contributions
防控
to
取得了
controlling
重
Ebola
大的战略性
and
成果。
achieved major strategic
我们将
achievements
聚焦
in the
新冠肺
prevention and
炎疫
control of
情的处置，
COVID-19. We
统
will
筹多病
focus on the
防控
response to
和紧急医学
COVID-19,
救援，
coordinate prevention and
进一步
control
提升
of diseases
应急的
and
处置
emergency
能力，
medical relief,
更好
and
地保
further
障
enhance
人
our
民健
emergency
康，
response
为
capacity
构建
to better
人类
protect
卫
people's
生
health
健康共同体
and contribute
做出
to
更大的
building a
贡献。
global community
谢谢。
of health for all. Thank you.
下一个问题，
Next question, please.
红区第2排这位女士。
谢谢发言人。21世纪经济报道记者
21st Century
基层
Business
是
Herald.
医疗卫生事业的王底，基层卫生机构能力强不
The
强，直接关系到
communities
老百
are
姓
the
看病就医
foundation
极难
of
筹看
our
问题的解
healthcare
决。
system
请问这些
and the
年我国
capacity of
基
community
层医疗卫
level
生服务
health
能力有怎样的发
institutions
展？谢谢。
have a direct bearing on people's access to healthcare
这个问
services.
题呢，请朱洪彪
How
先
has
生
the
呢来把相关的
capacity
情
at
况
the
介绍一
community
下。
level progressed in terms
谢谢您
of
的提
providing
问。
public health
强
services?
基层
Thank you for
始
your
终是
question.
卫生健康工作的
Strengthening
重中之重
the。community level
近年来，
institutions
基
has
层
always
防
been the
病
top
治病
priority
和健
of
康
our
管
work.
理能力
In
持
recent
续提
years,
高。
the capacity of
一
the
是基层医疗
grassroots
卫生网
level
络
in
基
preventing
本
and
实
treating
现全覆
diseases
盖，
and health management
服务的
has
可及性
been
进一步
improved.
提升。
First, the healthcare
截至去
network
年
at the
底，
community level
全国有
has
基层医疗卫生
been
机构
basically fully
近
established
98万个，
with greater
其中
availability
乡
of
镇卫生院
services. By the end of
3.5万个，
2021, there were
村
nearly
卫生室
980,000
59.9
community
万
level
个，
health
社区卫
institutions,
生服务中心
35,000
服务站
township clinics,
3.6万个。
599,000
二是服务
village
能力
clinics,
持续
and
增强，居民
36,000
认可度
community
逐步提
level
高。
health service stations.
制定服务
Second,
能力标准，
the capacity
完
in
善
providing
基础
services
设
has
施
been
条件。
strengthened, and with
2021
greater
年，
recognition
基
among the
层医疗
people.
卫生机构诊
In
疗服务
2021, the
42.5亿
community
人次，
level service
占全国
community
医
level
疗卫
health
生机构
mechanisms
总诊
provided
疗量的
4.25 billion services,
50.2%。
accounting for
三是基
50.2%
层
of
卫生人员
global
的
of
数量
national total.
大幅增加，
Third,
结
there is
构
a
不
significant
断优化。
increase in the number of
10年来，基层医疗卫生机构的人员
community level health workers
总数
with
从
improved
343.7
personnel
万人
mix.
增
Over
加
the
到
past decade, the number
443.2万
of
人。
community level health workers
村医
increased
队
from
伍中职业医师、
3.437 million
职业
to
助理医师的比例
4.432 million,
从
and the proportion of
18.5% 上升
certified
到
doctors
41.5%。
among the
家
village
庭医生签
health
约服
workers
务
increased from
稳步推进，
18.5% to
医患联系
41.5%.
和沟通
Now, the
得到
services
加强，
provided by contracted
健康教育
household
和引
family
导的作用
doctors
得以强化。
have been advanced steadily. There is
四是
greater
基本公
communication
共卫生
between
服
the
务
doctors and
体制
patients,
扩面，
and
促进
awareness-raising
公
efforts
平
have
享
been
有。
strengthened. Fourth,
人均基本
we
公共
have
卫生服务
raised
经费
the
的补助
quality
标
of
准
public health
由
services at
2012
the
年的
grassroots
25
level.
元 提高到
subsidies
目
for
前的
basic
84 元
public。health services
基
per
层机构
capita
开展的项目
has been
从
increased
10
from
类
25
扩展
yuan
到
in
12类，
2012 to
每年
84 yuan.
为高血压、
The
糖尿
programs
病、
carried out at the
肺结
community
核
level
等
have
重
been
点疾病的
expanded
患者
from 10
和
categories
0
to
到6
12
岁儿童、
categories.
孕产妇、
And we have
65
provided
岁
over 1
及以上老
billion
年人
healthcare
等
management
重点人
services
群
to key
提供
demographics,
10
including
多亿人次的健康
children
管理
at
服务。
age 6 and under,
这些项目的
pregnant
实施
women,
有效促
senior
进了
citizens at
城乡居
55
民
years
健康
old
水平
and
的提
older.
升。谢谢。
These programs have
下一个
contributed
问题。
a lot to the
好，
enhancement
东区
of
第3排刘女
health
士。
of residents at urban and rural
谢谢
areas.
主持人。海报新闻记者提问：无论何时何地，妇
With
女和
Haibao
儿童的
News
健康始终牵动人心。请问这10
The
年来，
health
在
of
保
women
障
and
母婴健康
children
方面，我
has
们采取了
always
哪些
been
措
close
施？
to people's
关于政策
hearts.
的调整，对
What
于保障
measures
母
have
婴
been
健康方
taken
面
over
提
the
出了更
past
高的要
10
求？
years to
请问下一
improve
步有什
maternal
么
and
新
child
证据？谢谢。
care, and what are the new
谢谢你。
steps that will be taken to
请
ensure their
杜杰
health?
先生呢，把相关的情况呢
I'll
介绍
give
一下。
this question to
谢
Mr.
谢这位
Du.
记者朋友的提问。
Thank you for your question.
孕产妇死亡率、
The
婴儿
death
死亡
rates
率
of
和
pregnant
5岁以
women,
下儿童死
infants,
亡率
and children
是
at
妇女儿童健
the
康
age
发
of 5
展的
and
核心指
under
标，
are the core
反映了一个国
indicators
家或地
of
区卫生健康事业的
maternal
发
and
展水
child
平，
health. It
也是
reflects
衡量
the
一个
public
国家
health of
和
a
地
country
区
or region.
社会经济
It
发
is
展水平
also
的
the
重要评价
important
指标。
indicators for
2021
assessing
年
a country or
全国孕
region's
产妇死亡
economic
率
and social
为10万
development.
分之
In
16.1，
2021,
婴儿
the
死亡率
maternal
为千分之
mortality
5.0，
is 16.1
5岁以下儿童死
per
亡率
100,000.
为
Infant
7.1%，
mortality is 5
较
per
2012
1,000.
年
And
分别
the
下
death
降了
rate of children aged 5 and
34.3%
under is
51.5%
7.1
和
per 1,000,
46.2%。
down by
从全球来看，
34.3%,
当前我国孕产妇死亡
51.5%
率
and
远低于
46.2%
中高收
from
入国家
2012
10万分之
respectively.
43的中位数水平。
At this stage, our
婴儿死亡率
our
和5岁以下儿童死
maternal
亡率均低
mortality
于
is
中高
far
收入国
lower
家
than the
9%
medium level
和
of
11% 的
medium
平
and
均水
high
平。
income countries,
中
and
国妇幼
infant
健康核
mortality
心指
rate
标水
and
平
death
位
rate
居
of
全球
children
中
aged
高
5
收入
and
国家前
under
列，
are
被世界
also
卫生组织
lower
列
than the
为
average
全
of
球妇
medium
幼
and
健康
high
高
income
绩效的
countries.
10个国家之一。
We have been recognized
进一
by
步推进
the
妇幼健
WHO
康事
as
业
one
高
of
质
the
量发
10
展的重
top
要举措，
performers in
可以
terms of
归纳为
maternal and
两
child
提
health.
升、两消除和一促
And
进。
for the new
两
era,
提
we
升
have taken
即
some new
母
measures.
婴
First,
安全行动提升计划
maternal and
和
child
健康儿
safety
童行
action
动提
plan
升计划。
and the healthy children
两消
action
除
plan have
将
been
启
put in
动实
place.
施消除艾滋病、
Second, we will
梅毒
launch
和
the
乙肝母婴传播行动计划，
action plan
和
to
加速消
eliminate
除
mother
宫
to
颈癌
child
行动计划。
transmission of
一
HIV,
促进
AIDS,
就是通
syphilis,
过
and
实施母婴喂养
hepatitis,
促进行动计
and
划，
also the plan
促进婴幼儿
for
良好生长发育
eliminating cervical
和
cancer.
母婴
And
亲密关
third,
系
we
形成。
will
谢谢。
promote the action plan to encourage breastfeeding
第2排
to
那位男士。
forge closer bonds between mother and children.
谢谢。封面新闻记者提问：我国已进入老龄化社会，随着老龄化程度的不断加深
China is becoming an aging society. With aging population growth, various health needs will also increase. What's China's plan and measures regarding this?
下边请呢，这个国家卫生健康委啊，老龄健康司的司长。
Now I'd like to invite Mr. Wang Haidong to answer this question.
好，谢谢关注老龄问题。
Thank you.
家家都有老人，人人都
We all
会。
have elderly in our
所以
home.
应对人口老龄化，事关国家
And
全
thus,
面发展，
responding
事
to
关亿万百姓福
a
祉。
population aging
我们国
matters
家
to
的人口老
everyone
龄化
and
呢，
also the
老年
interest
人
of
口
the
多，
nation.
老龄化
China
进程的
has
速度快，
a large number of
老
aging
龄化的
population,
城乡
and
差
this
异
trend is
和区
going
域差异大，
faster.
应对人口
There
老
is
龄化
also
的任务重，有这么
different
几个特点，鲜明的特点。
situations in
特别是
different
呢，
regions.
14、5时期啊，我们
The
国家
14th
将
five-year
从
plan
轻度
period
老龄化进入到中度老龄化。
We'll
这是
witness
一个
a
重要的窗口
transition
期。
from
国家卫生健康委
a low
和
level
全国
of
老龄办
population aging to a
认真贯彻
mid-level
党
population
中央、国务
aging.
院关于老龄工作的决策部署，认真落
We will
实
work on
习近平总书记
the central
关于老龄工
authorities'
作的重要指示
decisions
精神，
on addressing population
实施
aging.
积极应对人口老龄化国家战略，
and
将积极老龄
implement the
观
national
和
strategy of
健康老
actively
龄化
responding
这两个
to
理念
the
融
population
入到
aging.
经济社会发展全过
and
程，
integrate it into
努
the
力
whole
构
process
建
of economic and
老
social
年人的
development,
社会保障体系、
and
养
build
老
a
服务
social
体系
system
和健康支
of
撑体系
care for
三
the
大体系，
elderly,
落实好老年人的各项优待政策，
and
维护好
implement in
老
full
年人的合法权益，
our
弘扬
favorable
好
policies for
孝
the
老爱
elderly,
心的传统美德，
and promote
也
the
发挥
virtues
好
of respecting
老年
and
人的
caring
积极
for
作
the
用，
elderly,
让我们广大的老年人共
so
享
that
改革发展成果，
the elderly population can enjoy the
健康幸福晚年。
outcomes of reform and opening up,
那么
and
健
enjoy a
康老
happy
龄化
life.
是应对
Healthy
人口老
aging
龄化成本最
is
低、
the cheapest and the most
效益最
effective
好
way
的手段
to
和
deal
途
with
径。
population aging.
那“十四五”期间呢，我们将按照
During the 14th
“十四
five-year
五”
plan
健康
period,
老龄化规划的要求，
we will follow
重点做
the
好以下
plan
几个方面工
on
作。
population aging
就
during
是
the
做好
14th
老年
five-year
人的
plan
预防保健，
and work on the following fronts.
持续开
First,
展
we will
健
strengthen
康中国
preventive
行动
healthcare.
当中的老年健康促进行动，
We will
不断提高
implement the
老年人
elderly
的健
care
康素养。
promotion
我
measures,
们还要开展老年口腔健康、老年营养改善、
and projects
老
on
年痴
oral
呆防
health,
治、
nutrition improvement,
老年
dementia
心理关
prevention,
爱四
and
大行动，
psychological care will be
目的呢
conducted
就
for
是
the elderly
提高老年人主动
so
健
as
康的
to
能力，
improve their
让老年
ability
人啊
to
少
actively
得病、
pursue health
晚
and
得病。
avoid getting
不得
ill
大病。
often and early and
第
prevent
二呢，
serious
要
diseases.
做好老年人的
Second,
医疗服务
we
工作。
will improve medical
我们要
services for
持
the
续的
elderly.
推动在2级以上
We
综
will
合医院
advance the
设立
establishment of
老年医学科。
geriatric medicine in general
2025 年
hospitals at
这个
level
比
2
例
and
呢
above,
要达到60%以上。
and achieve the
同
goal
时呢，
of
我们要加强
60%.
康复医院、护理医院的
We
建
will
设，
also
还要大力的建设
enhance
老年友
the
善医疗卫
enhanced
生机构，
rehabilitation and nursing
落实
services,
各项方便老年人就医的各项举措。
and implement a number of
切实啊，
measures
方便
that
老年
make
人
medical
看病就
services
医。
more acceptable, more accessible
第三
to the
点呢
elderly.
就是我们要做好
Third,
失能老年人的长期照护服务工作。我们国家呀
we need to
有4000万失
carry
能和
out
部分失能老年人，
long-standing
对他们的
support
照顾
for the
是刚需。
disabled elderly.
所以我们要做好
Our
对
care
失
for
能老
them
年人的
is
健康
most
评估工作，
important.
为他们提供
We need to
从
evaluate
专
their
业
health
机构
conditions
到居家社区的全链条的
and provide the
长期
whole
照护服务，
chain
特别是要
nursing
把
care
医疗
for
服
them.
务下沉到社区和
Make
居
sure
家，
that the services can
切实的
be
减轻
delivered to
这
the
些
lo-
失能老
to the
年
primary
人家
level
庭的负担和全社会的负
so
担。
as to reduce the burden
第四
on
呢，
the family and the
我们要继
society.
续深入推进医养结合。
Fourth, we will
医养
deepen
结
the
合呀，
integration of
深受
medical
老
care
年
and
人的欢迎
healthcare.
所以下一步呢，
This is highly
我们还
popular
要
among
进一
the
步的
elderly.
推动养老服务资源
Next step,
和医疗资源的融合，
we
要
will
进一步
continue
扩
to
大医
integrate
养结合的
medical
服务供
resources,
给，提升医养结合的服
increase
务质量，
medical
要壮大
services
医
supply,
养结合服务的队伍。最终呢，我们要
and
建立起
enhance the team
居家
of
社区机构
the
相协
elderly
调、
care
医养康养相结合的整合型的健康养老
and
服务体系。
provide both
第五点呢，
rehabilitation
就是我
and
们要
medical
强化老
services.
年健康的
Fifth,
保障，
we will strengthen
要
healthcare
加
for
强
the
老
elderly.
年健康领域的学科发展，
We will
培养
strengthen the
老年健
development
康
of
领域的人才
geriatric
队伍，
medicine and related
要健
disciplines,
全老年健
increase
康领域的
the
标准规
training
范，
of
要
professionals
强
in
化
this
老年健
area,
康的科技发展和产业发展。
promote
总之啊，在
geriatric
“十四五”
health
期间呢，
technology and industrial
我们要致
development.
力于建
In
立完善
conclusion, we will
健康
focus
教育
on、
预防保健、
promoting
疾病
education
诊治、
prevention,
康复护理、
treatment,
长期照护、
care,
安宁疗护这样6位一体
hospice
的
treatment,
综合连续的覆盖城
and
乡
other
的老年
areas
健康服务体系，切实
to
提
protect
升老年人
the
的健康
elderly's
获得感。
health
谢
and
谢。
increase their sense of gain.
第
Thank
二个
you.
问题，前排这位女士，中区。
谢谢。浙江日报天目新闻提问：我们知道
浙江
基层
Daily
对于中医药的需求是很旺盛的，请问在畅
We
通中医药服
know
务
there
最
is
后
a
一公
great
里，
demand
如何更好的服务
for
基层群众方
TCM
面，中医
drugs
药开出了哪
and
些好药方？谢谢。
how do we bring TCM services better to the general public? Are there any good prescriptions for that? Thank you for your question. As you rightly said, since TCM services are very convenient and accessible, they are safe and effective, so they are very popular among the general public. In recent years, the National Administration of TCM has also given priority to strengthening the capacity building of providing community-level TCM services. We have initiated the program to provide better community-level TCM services so that the general public can benefit from such services. First, we will keep improving the community-level TCM service network. We have supported the establishment of 36,700 medical TCM stations, and a lot of the cities, and more than 90% of community-level health service stations, and 99% of community-level health service center now are able to provide TCM services. Second, we will further strengthen the development of community-level TCM teams. We have been strengthening training for young TCM teachers and provide better occupation services to enable more high-quality doctors to work at the community level. By 2020, there were 0.66 TCM general practitioners per 10,000 urban and rural residents. 82.4% of community health service stations had at least one TCM physician with clinical physician capable of providing TCM services. And third, we will popularize the appropriate techniques of traditional Chinese medicine at the community level. We have established 32 provincial level bases and more than 1,820 county level bases for the promotion of TCM techniques for common diseases. Now, community health centers and township health centers that could provide more than 6 types of TCM techniques accounted for 86.04% and 81.03%. And we also provide services, assistance, and training to the community level health centers. And going forward, we will continue to implement the decisions of the City Central Committee and the State Council, continue to leverage the strength of TCM, strengthen the capacity building of TCM service providers, and to provide better services to the general public and play a more important role in promoting TCM services.
谢谢主持人。新京报记者提问，我们关注到这个国家卫健委发布的3级公立医院的这个绩效考核的一个监测情况。数据显示呢，大部分的医院的在原有的水平上有一定的提升。
Most hospitals have different degrees of improvement over the original level, and regional differences are shrinking, but there still exists unbalanced and inadequate allocation of resources. My question is, what has been done to improve the allocation of resources, and what changes have been made?
谢谢。请朱洪彪先生来呢回答您。
I'd like to invite Mr. Zhu Hongbiao to answer this question. Thank you.
推进优质医疗资源的扩容和
Promoting the capacity expansion and balanced distribution of high-quality medical resources is a powerful means to address insufficient total medical resources and uneven regional distribution. Over the past decade, the NHC has further promoted the development of a tiered medical system and taken multiple measures to build a new pattern of orderly medical treatment. First, we have increased financial input and increased the total amount of medical resources. During the 13th five-year plan period, China has arranged 108.96 billion yuan to support medical services and its supply, 72.2 billion yuan on universal healthcare project, 14.58 billion yuan on public health prevention and control treatment capacity building project. In order to strengthen the building of medical institutions, especially county hospitals, the consultation rate of common and frequently occurring diseases in counties exceeded 90%. Compared with 2011, the number of medical facilities has increased by 8%, beds by 83%, and health personnel by 62%. Second, we have increased the capacity of high-quality medical resources and promoted balanced distribution among regions. During the 14th five-year plan period, we will build about 120 provincial regional medical centers so as to deliver medical resources to remote areas and narrow their difference with advanced areas in the country, and reduce the number of cross-provincial of patients receiving medical treatment in different provinces. Third, we have built a tiered medical system focusing on the construction of medical consortiums. We have carried out trials of tiered medical treatment in 4 municipalities directly under the central government and 317 prefecture-level cities, and the trials of medical consortiums in 118 cities in 32 provinces, and county-level medical consortiums in 827 counties. By December 2021, the number of two-way referrals had reached 28.8 million. The structure of two-way referral had been significantly improved. Medical resources and services have become more reasonably distributed and coordinated. Beijing Youth Daily.
In 2021, we won a complete victory in fighting poverty, and they also mentioned the healthcare program for poverty alleviation, which is a key step for fighting poverty. So what are the specific measures to prevent people from falling into or back into poverty due to illness?
卫生健康系统呢
The health authorities have been earnestly implementing the health care program for poverty alleviation, and we have helped nearly 10 million households forced back into poverty by illness to shake off poverty and made important contribution to the fight against poverty. First, we have fully fixed the inadequacies in terms of rural health institutions and personnel. To meet the goal of ensuring basic health care, we strengthened accountability at every level, sent medical teams and experts to the rural areas, and for the first time in history, addressed the shortages of medical facilities and doctors, and basically achieved fair access to basic healthcare services for the rural population. Second, the service capacity of county-level hospitals in those regions have achieved leapfrog progress. We have focused on the capacity building of county-level hospitals and encouraged 1,007 Grade 3 hospitals in urban areas to pair up with 1,172 county-level hospitals in 832 counties, so that each of these counties would have at least one public hospital, and 98% of the counties would have at least one grade 3 or above hospitals. So the gap between urban and rural areas has been narrowing. Third, we have been implementing targeted health measures tailored to individual needs. We have organized more than 800,000 health workers for a full review of the health conditions and provided tailored treatments to the poor patients so that they can receive tailored medical services and treatments. By the end of 2020, a total of 20 million people have received treatments. Fourth, we have made historic progress in preventing and controlling diseases in major areas. We have implemented a campaign against major infectious diseases and endemics, major diseases such as HIV/AIDS, high-dated disease and endemics have been under effective control. Graduating from poverty is not the end of the story, but the start of a new journey. We will ensure there will be no more backsliding to poverty because of illness, and to ensure full coverage of rural basic public health services and enhance the service capacity and level of providing rural public health services and contribute to greater health of the rural population.
谢谢。科技日报记者提问。
Science and technology daily.
In
the fight against COVID-19, vaccine R&D has not only enabled the Chinese people to use their own vaccines, but also enabled vaccines to be provided globally as public goods. So, what kind of role has vaccine R&D played in fighting the epidemic?
2008年开始啊，
Starting from
牵头组
2008,
织实施
the
新药创制
NHC
和传染病防治
has led
两
two
个
major
科技
special
重大专项，
programs, one
发挥
on
举国
developing
体制的优
new
势，
medicine and the other
组
on
织全
containing
国科研
infectious
团队
diseases.
合力攻关，
We have used our
在
strengths
卫生健康领域取得
of
了一
a
系列
whole
重大
of
的
nation
成果
system
和
and led our scientific
性的
and
进展。
research teams in a race to
近年
the
来，
top
通
and
过
achieved
新
major
药专项的实施，
outcomes
支
and
持获批
breakthroughs
上
in
市
public
一类
health.
新药
In
达
recent
到了
years,
80个，
we have approved
是专项实
80
施前的
Category
16
1
倍，
new medicines,
有力推动
for
我国新药研
commercial
发
use,
由
a
仿到
16-fold
创，
increase
医药产业
from
由
before
大
the
到
special
强的
program.
跨越式发展。
And China's
通过
R&D
传染病
of new
专项的实
medicine
施，
has achieved
我国
leapfrog
在重大传
development
染病
in embracing
诊
innovation
断、
and
预
strengthening
防、
the
治疗
pharmaceutical
技术水
industry.
平和科研能力
And
显著提升，
Our country's
主动
capacity
有
has
效应
seen
对
a
新
clear
发突发
improvement
传染
in
病。
the diagnosis, prevention, and
在抗
treatment
击
of
新冠肺
major
炎疫
infectious
情期间，
diseases. In the
我
fight
们一
against
周
COVID-19,
便
within 1
确定
week,
了新
we
冠病毒，
identified the
分离出毒株，
coronavirus,
清别
separated
出了
the
序列，
strain of the
向
virus,
世界分享，
completed the genetic
得到了世
sequencing
界
and
卫生
shared
组
it
织
with the rest of the world.
用创纪录短的时
The
间
WHO
甄别出
highly recognized
病
our
原体的
efforts
高
in
度评价。
identifying the pathogen in
我
record
们
time.
在疫情爆发的2周内，
Within 2 weeks
快
of
速
the
研发
COVID
了
outbreak,
高敏感性
we
和特异性的
swiftly
新冠病毒核
developed
酸检测
the
技术，
highly sensitive and
为早期诊
specific
断、
COVID-19
阳
nucleic
性
acid
感染
testing
者
techniques, which
筛
played
查
a vital
发挥
role
了至关
in
重要
early
的作用。
diagnosis and in
我们组织
identifying
了优势
the
团队
infected.
进行疫苗
We
研发
have
攻关，
organized
首创
a
了
strong
全球
team,
首个
put together a
高生
strong
物安
team
全
to work
风险
on
疫
the
苗
vaccines,
生产车间
and
技
we
术标准。 为后续
created
的
the world's
新冠病
first
毒疫苗
high
几十亿
biosafety
的
risk
安
vaccine
全
production
量产
technical
打下了
standard,
坚实的
laying
基
a
础。
solid foundation
我
for the
们组织
safe
了对药物
production
的
of
临
billions
床
of
前研究、
COVID-19 vaccines
抗体的
that
筛
have
选、
come after.
临床
We
试验、通道
also
打通和
put
快
in
速审批，
place fast tracks for
推动了综
developing
合抗
and
体、化药和中药
approving
等成功上市。
preclinical trial studies, the
医学
selection
科
of
技工作者
antibodies and
一直奋战在
clinical
疫情防控
trials,
的第一线，
and
展示了医学
encouraged
科
the
技
rollout of
和教育队
neutralizing
伍的
antibodies
良好风貌。
and TCM and other medicines.
我们
The
将继续
health
落实
workers
健康
and
中国战
scientists
略、
have been
科教兴国
working
战
on the
略和
front
创
line
新
of
驱动发展战略，
COVID-19
围绕关键技
of
术
the fight against
和科学
COVID-19.
难
They
题
have
不懈攻
demonstrated
关，
their professionalism.
为卫生健康事业发展提
And
供
we will
有
continue
力
to
的科技
implement
支
the
撑。
strategy of building a healthy China and provide
好，
strong
谢
scientific
谢各
support
位
for
发布人，
public
谢
health
谢各位记者
development
朋友。
in China.
今天的发布会就到这
My
里。
thanks go
再
to
见。
all the speakers and all the journalists. With that, we conclude today's press briefing. Thank you.